last part of electrical stim, we're going to talk about Chapter 13, electrical currents for pain, and just the iontophoresis part of electrical currents in Chapter 14. So the rest of Chapter 14, the electrical currents for wound care, will be covered in your special topics class next fall. So we're not going to talk about it very much here, but just know there's good information in the book if you want to check it out. But we are going to not cover it in this course. So we're going to talk about, in this section of the lecture, we're going to talk about pain modulation, conventional TENS, which means transcutaneous electrical nerve stimulation, low rate / acupuncture-like TENS, and so conventional TENS is sometimes called high rate TENS. Burst mode TENS, but which can have a little bit of a muscle effect. Iontophoresis, the mechanisms and parameters of Ionto, documentation for all of it, and then we're going to talk about modality integration. So how do you fit all these electrical stim applications in with other modalities that we're doing at the same time? Okay, so here's a typical setup for pain modulation, electrical stim. She's got a 2-channel TENS unit there with 4 electrodes, a quadrupolar setup for her upper back and neck pain. And we don't know what setting she's using because we can't tell from just looking at it. So there are a lot of different settings you could use for this. So transcutaneous electrical nerve stimulation, or TENS, is sort of a portable electrical stim to modulate pain. Conventional TENS or high rate TENS, low rate or acupuncture-like, burst mode, and electro acupuncture is talked about in the book. However, as physical therapist assistants and physical therapists, we do not do electro acupuncture, but acupuncturists do it. And they actually hook up electrodes, electrical leads to the acupuncture needles, and I've had it done, and it actually works pretty well for tendinitis pain, which is what I had it done on me for. So conventional TENS is high rate TENS. The interesting thing about TENS, it's really the landscape of TENS has really changed in the last few years. One of the big companies that manufactured TENS units was called EMPI, and we do have some EMPI units in the lab. They went out of business. What was happening was, it used to be that in order to get a TENS unit, you had to get a doctor's prescription. You had to go to PT. Different insurance companies had different. They were very expensive. They were probably $500 to $800. For one of the units, or sometimes your insurance company would rent them from EMPI or other manufacturers. And some insurance companies required that you had to have a certain number of PT visits proving that the TENS was effective for pain modulation, and then you would get the unit either as a rental or one that you keep. Well, now it's changed. You can go down to Walgreens and buy a TENS unit for $20. You can get on Amazon and buy 1 million different TENS units for, a reasonable amount of money. So now people are getting them without prescriptions, and hopefully they read the precautions in the book. So we still use them in the clinic, but a lot of times we're not. They don't need a prescription. We're not dispensing them to people, but we are maybe instructing people on how they're going to use them. Some people will say, well, I have a TENS unit I bought on Amazon. Could you show me how to use it? And then other people will say, wow, you might really benefit from a TENS unit. Here's some ideas of places where you might get one. They're so much more available and affordable now, and anybody can buy them. They're not. It's not a prescription thing anymore. So we're going to work a little bit with it in the lab But it's a more of a home treatment now. It's not something that you're necessarily going to charge for in the clinic. So conventional TENS, it's a short pulse duration which is set on the machine and a high frequency, and you adjust the frequency and you adjust the amplitude to produce a comfortable sensation without muscle contraction. It's gating. It's based on the gate control theory of pain modulation, and it's effective only while the stimulation is applied. It can have an effect. It reduces the pain and reduces muscle spasming, and so you have a little bit of a long-lasting effect. But a TENS unit, you could actually put it on. Someone who has chronic back pain, they could put it on while they're cleaning the house or wear it all day, or wear it at work. It's something that it's effective when the stimulation is applied, because it uses that gating technique. So you have to be stimulating those A beta fibers in order for it to work. So here's our little graphic. The A delta and C fibers, those nociceptive fibers, are sending their pain messages up to the dorsal horn of the spinal cord. The A beta fibers are coming in, the non-nociceptive fibers, and that inhibitory neuron is bridging the two and inhibiting those A delta and C messages to get up to the thalamus, which is our area of conscious awareness. Things don't consciously get to the cerebral cortex unless they go through the thalamus first. So usually the pulse duration is short. Usually you cannot adjust that on a TENS machine. It's set up already. It activates those A beta sensory nerves. Remember, on the pulse duration, on the strength duration curve, we're in the low end because it's a sensory application. The frequency is usually 100 to 150 pulses per second. It's pulsatile current, and the intensity is turned up just until someone feels a comfortable sensation. And sometimes some TENS machines have modulation to limited adaptation. Some of them don't. Sort of like microwaves. You get the more expensive one, and it has the button for baked potato, popcorn, and a bunch of other things. And you get the cheaper one, and it just has popcorn. So the settings that you get on your TENS machine depend on the price you pay for it, basically. If you get just your basic TENS, a lot of times they just have maybe 2 settings and on off, and you can adjust the intensity. So the home units now are so simple. They don't require knowing any of this stuff to use them. But when I'm telling people any kind of pain management electrical stim, whether it's TENS or something else, usually the first time I use it with someone, I'll say, okay, I'm going to turn it up and I want you to tell me when you first start to feel something. And so hopefully they tell you. And then I say, okay, now that you're feeling a little tingle, I'm going to turn it up more until it feels strong but still comfortable and not twitchy at all. And that's usually a good cue that gets people to where the amplitude that you want. So the low rate or acupuncture-like TENS, some home units do this and some don't. I bought a home unit from Amazon for $40, or I think it was like $39.95 or something, that has a low rate setting. And so it has 2 settings, high rate and low rate, and you can just pick between the 2. There's just a button. And then it has a bunch of different choices for settings. And a lot of the home machines, they have like neck, back, knee, foot, hand, different. That's how the settings are named, and it's just different settings. And really, you don't have to use the neck setting with your neck. You can use any of this, whatever setting feels good. The low rate TENS has a different effect. It's like 1 to 10 pulses per second, so it feels like a tapping almost, and we'll try it in lab. So instead of functioning with a gating effect, it stimulates endogenous opioid production and releasing of those endorphins and enkephalins and everything. And so it has that descending pain control. So it can be effective for 4 to 5 hours after the stimulation ends. Usually you don't do more than 45 minutes per session because you can start to get delayed onset muscle soreness from that tapping sensation, because we're repetitively doing a low-level stimulation of motor nerves. So actually I've had good success in the clinic when I have someone that comes in that has a headache we're doing different things. If they have a headache that day when they're coming in at the end of the session, do a low rate. It could be tens, or there's a low rate setting on IFC, interferential current. And I found it very effective for headache management. So the parameters, it's a long duration pulse. Usually it's preset on the machine. Low frequency, 1 to 10 pulses per second. Amplitude enough to get just a little bit of a twitching muscle contraction. So my little home unit, when you put the acupuncture setting on, it's like, you can feel that little pulsing. The pulse durations are at 100 to 300 microseconds, so we're into that motor range. And it activates motor and a delta nociceptive nerve, so it might feel a little more intense than the high rate tens. And the frequency is, it says 2 to 10 pulses per second. Each machine kind of is a little bit different. Some of them don't go all the way down to 1 to 10, some of them do. And we're getting that small muscle contraction. So burst mode tens is the same mechanism as low rate tens. It's just there's a burst and then an interval, and a burst and then an interval. So the burst is a lot of different pulses, but it feels like one. So it still has that same low rate sensation, and we'll try that in lab as well. So either you're going to use biphasic. If you're using not a tens unit, but the Chattanooga units, the clinical units that we use, you're going to use pulse biphasic or interferential. Sometimes pulse monophasic, but that's not used all that often. So as long as you have your pulse duration setting low, which is what you want for sensory stim, remember we're going for sensory stim, and then alternating current, we're going to get sensory stim anyway because of the way the settings work. So with the electrode placement, we want to surround the area of pain. So with tens, it doesn't matter if, so like this guy's got mid-low back pain, and we're surrounding the area with the electrodes. With the tens, it doesn't matter what electrodes go where, just all 4 of them are on there and you hook them up. With IFC, you have to cross the channels. So the upper right is going to be channel 1, the lower left is going to be channel 1. The upper left is going to be channel 2, the lower right is going to be channel 2. So they have to be in that cross pattern in order for the inferential to work correctly. And we'll try that setup in lab. So normally, so here's our conventional versus low rate tens, frequency, pulse duration, and amplitude. This is a table from the book. Conventional tens, you can do it whenever there's pain, and low rate tens maximum 20 to 30 minutes every 2 hours, because you don't want to get the muscle fatigue with it. So when you look at the pulse duration, just looking at that setting, you can tell, and looking at the frequency setting, you can tell what our goal is. High frequency, low pulse, we're going for sensory. Excuse me, low frequency, high pulse rate, or higher, not high, we're going for small muscle contractions. So there's your little tip off right there. So usually conventional tens, it only has effect while it's on. The low rate tens can have 4 to 5 hours after treatment. Some risks associated with the muscle contraction. Conventional tens is sensory only. A lot of times the low rate tens is used for chronic conditions. You don't want to use it for repetitive strain injuries because of that muscle thing. With conventional tens, you're using it for acute injury or repetitive strain because it's sensory. Tens, you could wear it all day if you want, conventional, and low rate 20 to 30 minutes max. So in the lab, we're going to be practicing with IFC. IFC is interferential current. It's an alternating current application. There's also pre-mod, which is also an alternating current application that uses a bipolar instead of a quadrupolar electrode setup. So if you want to do, say you wanted to do IFC on a really small area, like somebody's hand or foot, or a really small person that has small shoulders and there's just not enough room for 4 electrodes, that's a good chance to use pre-mod. So we'll try all those in the lab as well. As well as Iontophoresis. We'll do some Ionto in the lab. So with iontophoresis, we're using low amplitude direct current to facilitate transdermal drug delivery. So we're actually pushing it's a negative or positive medication, and we use the polarity of the charge to push the drug into the skin. Most of the time, I've used it one time with acetic acid, or otherwise known as vinegar, for an orthopedic condition. All the other times I've done Ionto, it's been with dexamethasone, which is an anti-inflammatory medication. The doctor prescribes that anti-inflammatory medication. At our clinic, we're part of the hospital, so we get it from the hospital pharmacy. At other clinics, I don't know where they get theirs, but your clinic will source that for you. So it's based on the principle that like charges repel. So you have dexamethasone's negative, you have a negative electrode that you inject the dexamethasone into, you put it on the skin, you have a positive dispersing electrode at a distant location, and the electrical current drives the corticosteroid dexamethasone into the skin. And the drug penetrates a few millimeters. So where I've used it the most in the clinic where I am, I work with a foot and ankle specialist as one of our PTs, and he uses it a lot with chronic ankle conditions. So that's just one. Plantar fasciitis is another one that I've used it with. So the drug penetrates a few millimeters. That's perfect for a foot because feet aren't that deep. If you were trying to do something at another location that had thicker tissue, it might not work as well. Another good place for it is elbow, anything with thin tissue. So the current dosage is usually 40 milliamps per minute. So if you're trying to put in 1 milliamp, or you're trying to put in 1 cc, you need to you're doing, let me say this better. If your treatment time is 40 minutes and you're going at 1 milliamp, you're going to be putting in 40 milliamps per minute. So the higher the amplitude, the less time it takes, is what I'm trying to say. So there's the machine, the little Ionto direct current machine looks like a little TENS unit. It's small, and we'll practice with them in the lab. They are usually you're using it for inflammation. The polarity, it's important to know, that's one of the things that I have marked in my book that I have at my desk at work, is the table in the book that has the polarity of the different medications, because I don't do it often enough. I don't remember whether dexamethasone is positive or negative. So even if I think I remember, I look it up every time just to make sure I'm setting it up right. So your dosage delivery is through your adjustments of the electrical stim parameters. So your amplitude, you gradually increase the intensity to where the person can tolerate it. So if somebody can only tolerate an amplitude of 1 milliamp, it's going to take 40 minutes to do the treatment. If someone can tolerate a higher amplitude, it'll take less time. So basically the same contraindications as electrical stim. If you don't have any skin sensation, you don't want to do it there. Areas of new skin tissue are susceptible to damage, and so if somebody's had a skin graft or something, you probably don't want to do Ionto right on it. If somebody has allergies to the medication that you're trying to drive in transdermally, obviously you don't want to do that. Or there are certain medications for certain conditions, like with pregnancy, you don't want to give someone corticosteroids. So again, pregnancy is always a precaution for, just about everything. So you want to take good care with the electrode prep and the application, because you can get chemical or heat burns, because you're with that direct current application, you're getting charge buildup at the electrode. So you want to increase intensity gradually over the treatment time, and you are not going to remove or rearrange the electrodes while the current is on, because that can shock you or the patient. So the other way that iontophoresis is delivered is low voltage iontophoresis, and it's actually like a little Band-Aid that has a battery built into it. I mean, that's what it looks like. It looks like a big Band-Aid, the 24-hour Ionto patch, and that is generally what we use at our clinic. So it holds a milliliter of dexamethasone on one electrode and a milliliter of water on the other electrode, and the picture on the right here has a little unit attached to it. Well, the ones that the battery's built in don't even have that, so it really does just look like that big Band-Aid. So you make sure you have your polarity correct. You inject the medication into the device, and you stick it on the person. So I have had people have skin reactions to Ionto. One gal had, it just looked like bruising. By the next time she came in, it was gone, but she took a picture of it with her phone and sent it to me, so that was nice. I could see what it looked like. It looked horrible, actually, but it got better within a couple days. So she just had a reaction either to the medication or to the electrode. But then the next time we did it, she was fine. So usually you're doing Ionto over a course of maybe 3 to 6 treatments. And I've seen people get really good results with plantar fasciitis, chronic ankle pain, sinus tarsi inflammation, Achilles tendon inflammation. So it can be a really nice application. In our clinic, we mostly use the 24-hour patch. We do use the portable units. Sometimes I've done it on people with altered sensation, and we use the portable unit because then we can monitor them the whole time instead of having them leave with it on there, and had good success with that. So we'll practice it in the lab. It'll be fun. So we want to make sure we have appropriate electrode placement and size. The active electrode is over the area of inflammation. So the active electrode is the one that's the opposite polarity from the medication that you're using. You want to have an adequate size so we don't get too much current density and end up with burns. And the polarity of the active electrode, is the same as the active ion. So you want to push it away, push it into the skin. So here's our little chart. Here's my favorite chart that I have to look up dexamethasone every time we do it. It's negative. So we want to have it on the opposite electrode. And we will practice it. We're going to practice in the lab with water. So there's an indication for using water for Ionto, and it's hyperhidrosis, which is like excessive sweating. So kind of interesting. But there are all these other ones. So the one acetic acid, I used it one time in the clinic, and it was someone that had a calcific tendinitis, and we used it for that. So that was kind of interesting. And the dexamethasone is the most common one. So, of course, you're going to document with IFC and with Ionto, area treated, patient positioning, Stim parameters, electrode placement, treatment duration, and response to intervention. And again, with the electrode placement, I like to take a picture and put that in the chart. Then, if you're seeing the patient the next time and you don't remember where you put it, it's right there. Or if another therapist is seeing them, there it is. It's right there. So it's nice to, a picture paints 1,000 words, right? Sometimes when I'm helping people learn to use a TENS unit for home, I will take a picture of the electrode placement so their friends and family can help them put the electrodes on correctly, because sometimes it's hard to get electrodes onto your own low back or upper back or something. So if somebody has someone helping them, it's nice to have a picture of what to do. Oh, that's a nice slide. You've just survived your electrical stim lecture. And this guy barely survived his. So The one thing I'm going to talk about is integration. Really, how, when we're trying to figure out what modalities to use, or what Stim modality to use in particular, what is our goal of treatment? How is this going to affect tissue healing or pain or motion restrictions or muscle tone? That's what we want to ask ourselves. We want to check on the contraindications and precautions. Is the modality safe? So if it's not safe for the person, we're not going to even consider using it. I love the way they have it in the book. They have the questions you should ask the patient. It's really nice to practice those when we're in the lab. I want you to practice them, and when we do our practicals, I want you to ask them. So it's important that we pay attention to those contraindications and precautions. So one of the things that we want to ask for all modalities, not just electrical stim, is, and not just modalities, but any treatments that we provide in the clinic, is what is the scientific merit? Does the research support the treatment? Do we have good research that supports doing this treatment for this particular, that says the treatment's effective for this particular condition? You know, so that is important. And that's one of the reasons why the Fall Quarter Project is your literature search and your presentation, because we want to make sure that what we're doing in the clinic is scientifically supported, and there's research to support the idea that it does help for that condition. You also want to consider cost, convenience, and availability. So what I was saying about the TENS, where now it's available for just about anybody, who's going to apply it? Is the person going to be able to get the electrodes where they need them? Like I was saying, take a picture of the electrode setup so then the patient can, their family and friends can help them. How much time is it going to take? Is it going to be something that they're going to be able to do on a regular basis? In the clinic, is it something that you're going to have enough time to do in the session time that you have? Can it be used by the patient at home, like a portable TENS unit? So you want to take that into account: cost, convenience, and availability. You don't want to do a treatment that the patient's not going to have access to.